Hello, and welcome to my presentation on the intersection between climate change and global health. My name is Eva, and I'm a rising junior at the Weber School. Here are some of my extracurricular activities. When I'm older, I hope to pursue a career in pediatric oncology or surgery. So let's dive into some background information about climate change. Climate change is when the weather of a certain area deviates from its typical weather patterns, such as changing amounts of rainfall, temperature, and other factors. Studies show that burning greenhouse gases like carbon dioxide have caused heat to be trapped in the Earth's atmosphere, which has further changed the world's climate. Climate change is caused by a variety of factors, such as naturally occurring volcanic eruptions or human activity. So by now, you may be wondering, what does climate change have to do with global health anyway? While they may seem like two totally unrelated fields, there is more than what meets the eye that brings these two areas together. For one, it has been discovered that in the past 130 years, the Earth has warmed by 0.85 degrees Celsius. While this seemingly tiny rise in temperature may seem insignificant, climate change has caused tremendous impacts on how people stay healthy. Climate change has already increased death tolls from disease and health complications. In fact, it's predicted that there will be 250,000 deaths per year between 2030 and 2050 caused by climate change. And by 2030, damage costs to health will amount to between $2 and $4 billion. If left unattended, these significant ramifications of climate change can cause serious health complications around the world. Today, we'll focus on two main areas of global health that are affected by climate change: the harm that climate change brings to pre-existing conditions and health issues caused by extreme weather events. Climate change can cause serious damage to the management of a variety of pre-existing conditions, both relating to physical and mental health. Rising temperatures and other factors can interfere with medicines, aggravate symptoms of medical conditions, and worsen stress and mental health in general. An example of a common condition that is affected by climate change is asthma. Asthma is a common chronic health condition affecting 5 to 10% of the global population. Asthma narrows and swells airways and can cause them to produce an excess of mucus, causing coughing, wheezing, and other symptoms. For some, asthma may just be a minor nuisance, while for others, it can disrupt daily life in several ways, especially with the risks of life-endangering asthma attacks. While there is no cure for asthma, medication and the avoidance of triggers can control asthma over time. Effects of climate change, such as the aftermath of extreme weather and increased air pollution, can cause harm to the already compromised lungs of asthma patients. In fact, excess air pollution close to housing developments caused the death of a young girl with asthma in 2013. And these issues are only increasing. Studies have found that between 2016 and 2018, air pollution has increased by an average of 5.5%. This rise in air pollution is believed by scientists to be caused by the burning of natural gas and the release of pollutants into the atmosphere from cars and other modes of transportation. Another significant effect on global health caused by climate change is extreme weather events. Extreme weather events, also known as natural disasters, can cause serious issues for individuals' security, property, safety, health, and well-being. They can also create problems regarding other global health issues like malnutrition because of food shortages caused by the destruction of crops, rations, and other food sources in communities affected by natural disasters. In addition, events like storms and floods can have a detrimental impact on the health of individuals living in close proximity to a natural disaster affected area. In the past 30 years, the number of natural disasters related to climate change have tripled, which means that these environmental catastrophes aren't going away anytime soon. Some examples of natural disasters include floods caused by rising sea levels, storms, wildfires, earthquakes, and more. These events often cause immediate evacuation and destruction with little notice, which can often force people to leave behind life-saving medications when they evacuate. The aftermath of these extreme weather events, such as the growth of mold and the release of toxic chemicals, can cause health issues to those who knowingly or unknowingly are exposed to them. While there are many examples of natural disasters, a well-known example is the recent California wildfires. Although some wildfires have been started by human activity, the root cause of the immense danger caused by these fires can be attributed to the so-called perfect wildfire weather: dry, windy, and warm. This weather pattern has more than doubled since the 1980s, creating quite literally the perfect storm for extreme weather events to happen. Recently, massive forest fires in California have been making headline news, with at least 8 deaths and 3 firefighters hospitalized as of September 9th, 2020. Forest fires are no issue to ignore. Not only do forest fires impact those caught in them, but severely impact the area around them as well. Smoke from the wildfires can cause damage from miles away, as the smoke can severely irritate the lungs and eyes of people, even from a large distance. All of these factors combined can lead to severe health deterioration or death. With the dangerous carbon dioxide emissions of forest fires at 3 times their normal level in 2020, it's definitely time to take action against the effect that these fires can have, both in the area they burn and surrounding areas. After learning about all of these global health threats caused by climate change, you may be wondering what solutions are being developed to combat these issues. Some solutions that can improve climate change and global health at the same time include promoting alternative transportation methods like bicycles and walking rather than driving, which lowers carbon dioxide emissions and promotes a healthy lifestyle at the same time. In addition, increased sanitation can combat diseases spread through improper hygiene caused by a lack of clean water, an issue that affects around 40% of the global population. Lastly, innovations such as preventative healthcare to prevent health complications from climate change, as well as collaborations between climate scientists and healthcare professionals, can solve issues that intersect both fields. So, what can people do in their everyday lives to promote climate and global health solutions? Simple solutions like lowering one's carbon footprint by avoiding energy and technologies powered by natural gases, and instead opting for usable materials and renewable energy sources, are great ways to prevent increased waste and the release of carbon dioxide into the atmosphere, which in turn can hinder the effects of climate change. So, to conclude, as these threats of global health increase due to climate change, resources for people facing the downsides of climate change will become more important than ever before. Finding solutions to specific global health issues caused by climate change, such as complications to pre existing conditions and extreme weather, are vital to preventing global health crises in the future as the health of the climate worsens. Solutions such as promoting healthy lifestyles that lower carbon emissions and taking preventative measures must be integrated into society to avoid further global health issues fueled by climate change. So that is all of my research. Here are some sources that assisted me with creating this presentation. Lastly, I want to thank you for taking the time to watch my presentation. I really appreciate your interest in promoting climate safety and global health. If you have any questions at all about my research, feel free to contact me via email. Thanks again for your time and have a great day.